Cancer is a type of functional disease that occurs when cells grow abnormally in the body. It can start anywhere and spread to other parts of the body system. This epidemic is the most second cause of death throughout the world. For a better and a healthy lifestyle, eat healthy food, keep a regular exercise, do the things you love to do, limit alcohol intake, stop smoking, take a rest from a long distance of activities, and finally, go for a regular checkup. Hello, welcome to Healthy Living on Asset Television. I am your regular host, Blessing Chima, and with me is Dr. David Babalola. You're welcome on the program.
Thank you very much.
So today we're talking on cancer. So Doctor, what's your overview of cancer?
Okay, so because of the people that are watching, I'll try to make it as simple as possible. Cancer is unregulated growth, basically. So our body is made up of cells. We have it's cells that make up the different parts of our body, and those cells have a way that they have a predetermined rate of growth. And for example, some cells multiply every 1 day, some multiply every 7 days, some every 5 days. Now, when a cell goes faster than normal and it is unregulated, it doesn't have check and balance. That gives rise to cancer. So cancer generally or basically is unregulated growth of cells in our body.
It's okay. So what are the causes of this cancer?
Okay, so cancer could be caused by myriads of causes, and that will vary from different parts of the body. I would like to also state first of all that cancer could occur in virtually every part of the body, every organ of the body. So, and based on the different organs will determine the different, I think it's only even maybe only the heart, but I think I've seen in the literature before that even the heart there is cancer, but it's only the heart that has rare cancer, but every other part of the body could come down with cancer. And so the causes of it could vary. I think I should classify it this way. They are biological causes. Biological meaning organism, microorganisms that could cause it. For example, there are bacteria that could cause cancer. And an example of this bacteria is the one that causes, you'll be so surprised that the one that causes ulcer, the H. pylori that we talk about, yes, on a long term after years, is one of the causes of gastric cancer, cancer of the stomach. Then also viruses to hepatitis B virus, hepatitis C virus.
There are many causes.
Many causes. That's why
you cannot actually trace a particular one that causes cancer.
In fact, that is why it's a very broad discussion. So there are even fungals that cause cancer too. That are known to produce yes, but for not the fungal infection of the genital tract of the private part, fungal infection of the liver too. There are some of like in these beans that we store, some of these preservatives, they contain some what we call the aflatoxins that are known that could damage the liver. They could cause scarring after some time, a lot of inflammation, cause what we call cirrhosis, and then the person could come down.
Basically, that means when we eat all causes the one.
In fact, that's yes. If a saying says if you don't take your food as your medicine, after a while you take your medicine as your food. So because if the food we eat, we should make sure we are very careful about it. We are careful about our medicine. I have to take it this time, that time, and we are very careful about it. If not, later the person will begin to take medicine as food.
So when you talk about the food we eat, what actually are you talking about?
Okay, so generally, okay, so I'll just give it an umbrella, not to paint anybody. It's something everybody knows. The Western food generally, a lot of our Western food have been linked to cancer. These burgers we eat, the pizzas we eat. The reason is many of the preservatives. These hot dog that we eat, sausages that we eat has been linked. Now it's not as if once you eat it once there's a problem. I won't say it for our viewers. Shawarma, yes. So it's not as if once you eat it once, once you eat it once that it will cause. No, but it's a long term. So it should be something that just once in a while.
Okay.
Once in a
while. It's not as if we are avoiding it total.
Total 100%. Yeah, exactly. It should be very minimal. Maybe you just feel once in 3 months. Maybe once 3 months, maybe once in 4 months. You just decide to take one. The person can take one. So the foods we eat.
With the high cost of food now, people are just trying to put anything in the stomach. Yes. So far, as long as they are not hungry. So how about that?
Well, yes, for that, and I think it's the irony of it. Formerly, healthy cooking was cheaper. before to buy, but nowadays it's and that's that, and I think that's part of what is causing the problem. Because before, to eat foods that are healthy, to eat rice, beans that are much healthy, whole grains that are much were much healthy, they were cheaper. But right now, I think it's even the snacks that are cheaper than
Of course.
the food. So
And the snacks itself is not.
it's not healthy. So it one should prioritize their health. You prioritize your health. You should not say because you want to you want to eat something cheap or just satisfy yourself. Because the thing is, it's a cumulative effect. The thing about many diseases, especially cancer, is that they're cumulative. It's not the day you start that the effect. No, it's cumulative. After a long time, continue till one day, um, then it comes down.
After a long time, like for how long?
Okay, so different cancers have different timeline. It's a we call it adenoma carcinoma sequence, or we call it the sequence in which it happened. So some occur faster. Some cancers will take a long time. They are slow growing cancer, like some brain tumors. They may be there for a long time. They may be growing for a long time, and may not even developing for a long time rather. But some little. In fact, that's why you can see some cancers that occur even in childhood, in a very young child. The child was just a little, and then it's already child already had that. So some cancers develop faster. Um, some blood cancers, for example, if you say acute leukemias, when we hear talk about acute leukemia, that's of the blood. These ones occur much faster. But some other cancers, as they take long time. In fact, you see them in the people in their 80s, in their
And
70s.
even one is at least to me
Is-
somehow it's better.
because the person is
But
on his
which
way
are
out.
those cancers that that take time to develop, probably to 80s and 90s?
So now when we talk about leukemias, we have acute leukemias and chronic leukemias. So when we say acute means short. It occurs very quickly, suddenly. So acute leukemias occur generally in young people. In fact, the acute leukemias I've seen in the wards, in the emergencies, are usually in young children. I've seen acute leukemia in a 24-month-old child. I've seen acute leukemia in
Does
an
it kill
18 months.
fast?
Yes. Oh, in fact, we lost that one. We lost the one I saw. We've also seen in younger children. But when we say chronic, the chronic I have seen too are in the 70s. Are people in their 70s. In fact, the man was 72 or thereabout. So for chronic, in fact, I don't think you can see chronic leukemia unless maybe the person has offended so many people. But you can't see chronic in a young child.
Oh
You can't.
wow, it is way. So what are the symptoms of this cancer disease?
Okay, now cancers, like I said, could occur anywhere. So maybe I'll just give based on the different areas it could occur. We have a childhood cancer called retinoblastoma that occurs in the eyes. So for example, maybe I'll go to the give each organs
You
and
mean
then
we have cancer of the eyes?
yes, and it's commoner in children. It's common in children. It's common in children. You see them in children of 2, 3 years. In fact, it's you see their eyes bulging out. So for that one, for example, that one, the child, you see that child is losing his vision. The child, instead of when you shine light on the eyes, it's produced. Have you if you've had a cat before, and you call it cat reflex. If you shine light on a cat in the night, on their eyes in the night, you see that it produces like a white. You'll almost be scared. I don't know if it has happened to you. You are shining light in that.
Sparkling.
Yeah, it's sparkling. So that, but in a human being, if you put light on their eyes in the night, you don't have that effect. But for a child with that cancer of the eye, it will be like a cat zone. We call it the cat reflex. So the whitish on the background, cat-like reflex. So that is for that one. For the nose, we have of the pharynx. Okay, that's the throat. That one, the person could have difficulty swallowing because that's where food passes. The person will have difficulty swallowing. Could have it could even spread to adjacent areas. So the person could have difficulty in swallowing. For cancer of the stomach, the person could be vomiting because the cancer has taken over the space. So the person eats, vomit, food is not going down because it's blocked. For cancer of the bone, the person could have what we call pathological fracture, meaning that the bone is not as strong. Because you see, one thing about those cells is, maybe I should have said, is that it's unregulated growth. That means the cells are just growing faster than normal, but they are abnormal cells. They are not as strong as our normal cells because it's like you are telling, it's like maybe you have factory workers and then you are telling them produce, and they can normally produce 2 of that product in a day, and then you now tell them produce 10. That 10 will be substandard product because they are just quickly, let me just put up and meet up with what my boss wants. They are not really putting in the effect. The cell, everything is not
You're
is
growing abnormal.
abnormally, so it's weaker. So you see that like for like in the bone now, we call it osteosarcoma. You could have osteosarcoma, you could have chondroma. The person who have pathological fracture, you could just be walking and just hit his leg against this table, and hitting your leg against the table should not cause. Many people have hit their legs against several, but and then that will come down in fracture. You go and do an X-ray, and then you see that they have fracture, cancer of the kidneys. The kidneys will not be working. Person will come down with renal failure, cancer of the liver. They will have jaundice. Their legs will be swollen. They will lose weight. All the functions of the liver will be lost. Cancer of the brain, they could lose their.
That's the most dangerous part.
Yeah, in fact. So
I don't think people survive that.
people do. In fact, I think I will also talk about that too. That there are several myths about cancers. So people do. You see, so many people think cancer is a death sentence. In fact, we have a group. I'm a member of the Consortium for Cancer, International Cancer Fighters. We are global consortium against cancer. And people do. It's part of the things that I would like people to know that. But the thing is, people present earlier in the Western world than here. So there's so many people, they're already on their way out before they come and present to us. And usually, the earlier you present, the better your chances. We've seen people that beat cancer several times. In fact, I was watching a woman that beat cancer 6 times.
Are you serious?
Yes, cancer came, she beat it, continued. I think after a while, it came again. So it could come
Maybe
again.
she started her own early.
Yes, early,
came early.
exactly. So
Treating
yes, and that's why for things like breast cancer, we always tell women we have breast International Day of breast cancer. We tell them to self-examine themselves. Women above 40 should have mammography. So when Buffy examine the breast, we teach them how to examine the different quadrants and make sure that they are because once you pick it early, there's a lot that can be done. In fact, your quality of life will be better than when it has gone.
The earlier you identify it,
the earlier you identify it better. Yes. So that's why routine checkup is not a waste of money. If you just go to the doctor and say, I just want to check up my organs, I want to just do tests for my organs.
General body test.
Exactly.
Wow.
General body test.
That's interesting. So we're going to the streets to find out the overview of cancer, what people are saying about cancer, what they understand about cancer.
Talking about cancer, my father used to tell me when he was alive, and I saw it at my age. Things like that never existed. We never knew what cancer was. It wasn't as much, as we have it now. It's due to economic hardship. Things are so hard. People eat all sorts of things, junk. That is why all these things comes out like that. And it appears many more will even come because things are not getting better. The leadership is not showing us a way out. So people just barely survive. They eat anything. I believe that is part of the cause of these cancerous activities or diseases. My advice, I believe most of these things they have natural cure. Assuming people get back to the roots, how it used to be. When we have good governance, people begin to eat well, eat natural things instead of all these artificial things, chemicalized, that cause trouble to the body system. I believe that is the way out. The root, is our leaders bringing back our land how it used to be. It used to be in agricultural setting, we get natural things to eat. The other day, someone was even telling us that there's a kind of rice that is produced with chemicals. You understand? I don't know how true that could be. But with the things that are happening, I don't have any doubt. Everything are chemicalized. That is what I mean by going back to the basis or to the root. Government should have proactive measure towards returning us to where we ought to be. We are Africans. We have natural endow. Look, listen. If you lick a mango now and throw it away, by the time you come here, that side next a year, it will grow by itself. Not all these chemicalized things, inorganic or whatever. Most of these apples they do bring to us, I understand there are tax. There are meaning to that tax. It is meant for the Oyibos, not for us. Are you getting me? I can't see the reason why I should take Indomie in the morning or spaghetti. Naturally, I'm a local man. grounded from the village. I take apple, I feel okay. With bitter leaf. Are you getting me? All this moringa they are talking about in my village, that is what we used to have as fence. We used to prepare stew, eat naturally, and feel strong. Okay?
About cancer, I've had one or two persons who have actually suffered from cancer, and I can tell you it's a very terrible disease. You know, they say cancer is an abnormal growth in any part of the body. So you have the breast cancer, you have the colon cancer, prostate cancer, and all manner of cancers. And it's a very dangerous ailment, because one of the things I have observed from people that are cancer patients is that it is actually a resources drainer. A lot of people will spend everything that they have and will still pass on due to their illness. And I think what the government should do is to try and invest on, apart from cancer drugs, I think on awareness. There are certain food, there are certain things that are done that actually leads to cancer. You know, I think those regulations are very important, and the government should look into it and make sure that the things that we consume are things that are good for the body. And people should also learn how to consume fresh food, our local food. I don't think our local food will cause cancer, but because people are too interested in so many important things. I think that is one reason. I can't see, I'm not a doctor anyway, but I think that people should watch what they eat, and the government also should put up cancer institutions. Like in Abuja now, I think there's only one cancer center, and I don't know how effective that cancer center is in Abuja. But by and large, cancer is bad, and everyone that is experiencing it today, I just pray that God will help them, God will heal them, and help them to come out of it strong.
All know cancer is a disease, and it is known as a deadly disease. It is a disease that when it strikes, like it affects the whole system of the body. When it has now grown to the level that which is not controllable anymore. But there are ways that cancer can be preventive if you got to know that you are about to have it. I think it is medically advisable that it can be nipped in the bud. But maybe due to non-awareness or due to ignorance, somebody may not be aware or may not even in the know that a kind of disease that is affecting him or her is a cancer-prone disease. So there should be a kind of serious sensitive awareness about cancer, and at the same time about what can lead to cancerous diseases, be it from the food we take or the environment we live in. So all these are things that need to be put into consideration. Although cancer don't just form, or just a disease just result into a cancerous disease. It is a stages, but when it is in earlier stage, when medical precaution is taken, I think it can be eradicated at that level.
Cancer is a reality disease. Call on the government, you understand, to also invest heavily in cancer drugs.
The government should create more awareness on it. I lost an aunt. My aunt. She died of cancer, and it was very, very horrible and really sad. So we need to try and maybe go for checkup and try and do our own part. So I think the government should please create more awareness and just try. any way we can, the health sectors, to help people, because it's something that is really bad.
Cancer is a very deadly disease that is very, very hazardous if proper care is not being taken. It's a disease that can lead to so many damages. It can cause you, let's say, cancer of the breast, cancer of the lungs, cancer of all various organs. Cancer can occur anywhere. So when not properly attended to, it can cause to so many damages to your body. So my own application and supplication to the government is that they should look more towards making availability of the drugs at which will be used for the treatment of cancer. They should prepare and combat cancer the same way they are combating malaria and other yes, HIV. They should prepare for cancer as well. Get the necessary drugs that will be administered to any cancer patient.
Wow. Imagine what people are saying about cancer. That's what they believe, what they probably understand so far about cancer. So I want to ask the doctor, what is the wrong belief of people about cancer?
Okay, so it's also, I would like to also state that it's a burden that we face even as doctors in the hospital, because so many patients would have the wrong beliefs. Some people have said that it's not even the cancer that kills people, but rather it is the stigma, the fear, the way they've been treated. So many people become homeless because of cancer. So many people, their husbands leave them. In fact, there's one I still know, the woman eventually died. Exactly. So some of the wrong beliefs that people have is that cancer is communicable. Sometimes they see the large size of the mass in whatever organ. You can imagine a child coming out with child having the eye, the big eye, that's the cancer of the eye, retinoblastoma. Or you can imagine someone having what we call follicular cancer, thyroid cancer, and then the person having a mass on the neck or on any other part of his body, and then people are looking. So cancer is not communicable. That's the first wrong belief that people have, and I would like them to know it's not communicable. Number two is that cancers have several causes, which will still I think I've talked about one or two of them. It has several causes. It is not caused by, some people think it is caused by, okay, you have been so bad in your life, you have been a bad person, and that's why.
Or maybe somebody cast a spell on you.
Yeah, exactly. They cast a spell, and then they would have tried several homes, several spiritual homes, and what we usually tell people, because I know Africans are very religious, and it's okay, but you combine both. You can do your spiritual while you are praying in your church, in your mosque. You should also come to the hospital and seek medical care. It should not just be that you just stay. So many times people call me stage 4 breast cancer, and by then it has spread to distant organs, it has spread to the lungs. They can't breathe very well again. So it is not cancer is not it's not for you to stigmatize and then hate the person and feel, you see, she has been you have been a bad person all your life, and that's why this is happening to you. About now, the third one I want to talk about is that cancer is not a death sentence. It's not a death sentence.
Take care of a cancer patient.
In fact, you can still live long with it. You can still live long. Like I said, people don't die from the cancer itself. It's from the stigma, lack of support. They're not having support from their family, from their spouse, from their relative. Maybe become homeless. Yes, become homeless. In fact, and sometimes even maybe I would like to speak to my colleagues too. Sometimes the way I know of a woman who had cancer, and she didn't go back to the hospital because she said the doctor didn't attend to her well. So the way we also break the news, the way we also communicate with people, we should assure them, allay the anxiety. It's one of the key steps. You should let them. We should not just, you have cancer and then you have this number of, and this is how it is
to live.
To live. No, and the person is already
just that word alone.
Yeah,
the person
exactly.
is running up for death.
So
Wow.
they should also know that. So both from the physicians, the doctors, and because cancer is treated by different specialties, so it's not just one. Different places we all see patients. In fact, you may not even see them for the cancer. You may see them for something else, and then they'll just mention, I'm also treating cancer and all of that. So we should make sure that every contact they have with a doctor is giving them hope, giving them life. So many times when we have the reason and to live, and it helps in fighting it better.
Wow. So what are the cure for this cancer? How do we treat cancer?
Okay. For the cure for cancer, um, I'll divide into two. There is the pharmacological pharmacological aspect, or let me just say the medical aspect, and then we have the non-medical aspect. And I'm saying non-medical aspect because that is the one that concerns the people listening. I'll still come to the medical aspect, but for non-medical, there's lifestyle adjustment. For example, people with cancer should eat more fruits. People with cancer should drink more water. People with cancer should avoid infections more. Cancer has the tendency to reduce our immune system, especially for the ones of the blood.
So you see, reduce the infection.
So for example, let your environment be clean. Bath twice a day. Any cut, quickly treat. It's not the type that you have a cut and then you treat. Avoid and then you don't treat it well. Sorry. So you treat infections well. You see someone coughing, you don't go around the person just anyhow. Cover yourself, protect yourself well, clean up yourself. Immediately see an infection, quickly treat it. It's not you have cough, you have stomach, don't eat just anyhow. Suya and all of those things that you are not sure of how clean they may be. So prevent it. Then for the medical aspect, we have surgery for them. There are some cancers that you may need to remove just the cancerous part. Some may need to remove the whole organ depending on how it has spread.
Like the breast cancer.
Exactly. So for breast cancer, if it is picked early, the woman can still save her image, because so many times by the time they present to the hospital, they have to remove the whole breast, part of even the armpit, and by the time they will disfigure some of them, you can imagine a woman who
the armpit is inclusive.
Yes,
as well.
for some of you, what we call a maxillary node dissection, you have to remove because it spreads commonly to that part. So many times you have to remove it, because for cancer we don't just remove where we see. Too many times there is what we call seedlings. It may have spread little that we can't see, so we remove around even the surrounding area. So that's why if it is still small, even if you remove a little about the surrounding area, the woman still has them, because you have to remove the whole breast, something called toilet mastectomy. That can be really disfiguring. So the woman should breast examination is essential. In fact, we recommend it for all girls once they are getting to puberty. So you are bathing once in a while, touch around, and especially if they have family history. I think I should have said that family history is so if there's any cancer that's run in a person's family,
it's because of what causes the cancer.
It's a predisposing factor. Many cancers have some familial, we call it familial basis, or from familiar routes that it occurs. So once your family also too. So I talked about surgery, I talked about the drugs. We have chemotherapy. Then we also have radiotherapy. Now it's quite it's an irony that you see that the thing I talked about ionizing radiation causing cancer, and I'm also saying that radiation also too can be used to treat cancer. So it's like the blessing that in the same place where you find problem, you also find solution too.
Okay, there are situations whereby you take away the surroundings, the cancer surroundings, you remove them, and it still spread or it still grow. How true is this?
Yes, so yes, it occurs, but that's why we do what we call post-op chemotherapy. We call post-op chemotherapy. What that means is that after you remove, you still follow up with chemotherapy. You still give them chemotherapy that will be systemic to kill any other one that may be remaining. So that's what we do. We don't just remove surgically. We also give chemotherapy in courses, in cycles afterwards.
Okay. What's your advice now to the people out there, especially to those that are suffering from cancer?
Okay, so my advice to them is, number one, you can beat it. If you follow some of the things we've said, the things your doctors have told you, you can beat it. It's very possible. It's your will to live. Like I said, many people don't just die from the cancer. They die from, isolation, the rejection, the lack of funds, lack of support. So with the right mindset, you can live longer than you actually think. Then another advice I also want to give is prevention is better, much better than cure. So if you can prevent most cancers based on the different things that cause them, it's better. When cancer is picked early, the prognosis is way better.
Wow, my daughter has said it all. I have barely nothing to say again. The only thing I can tell you, try as much as possible you can to avoid cancer and its deadly disease. So for now, we are rounding up our program till we meet again next week. Keep watching Healthy Living on Asset Television. I'm Blessing Chima.
Welcome to Asset Television, your best station for news, politics, business, sports and entertainment. Your one-stop channel, Asset Television.